In medicine, confusion costs marks and mistakes cost lives. Stop memorizing, start understanding. This is Dr. ABM, where medicine finally makes sense. What's going on, lovely people? Today we are going to be looking at one of the most important sections in physiology, as blood, plasma, red blood cells, oxygen transport. We'll quickly take a quick look at these things and the hidden reasons why disease like anemia, thrombocytopenia, and leukopenia can completely change the body. It's very, very, very important. In this video, we're going to connect everything together in a way that actually makes sense clinically. And what are we going to talk about? We're talking about connecting plasma proteins, albumin versus globulin, red blood cell, white blood cells, platelet, hematocrit, hemoglobin, erythropoiesis, blood viscosity, osmosis, coagulation. We'll also look at why edema develops in liver disease and nephrotic syndrome. Trust me, once you understand this video, physiology becomes way easier. So let's get right in. The function of plasma proteins, we use they act as amino acid source. They are used for buffering, for capillary function, for defense, osmosis, transport. We use ABC dots. Now, osmosis is extremely important clinically, and albumin is the major protein that is responsible for oncotic pressure. Hydrostatic pressure pushes fluid out, oncotic pressure pulls fluid in. And because albumin is numerous, the most abundant, it creates most of the osmotic pulling force in blood vessel. So if albumin drops, fluid leaves the vessel and enters tissues, and what happens? Edema. And that's exactly where the clinical correlate of liver disease, nephrotic syndrome, and severe malnutrition comes in. Very important. Next up, we'll quickly talk about body water and plasma volume. Now, plasma itself is mostly water, and total body water is about 60% of the body weight. And remember that most of this water is ICF. Remember our 60-40-20 rule. Yeah, so you should remember. Now, the average adult has roughly 3 liters of plasma and 2 liters of red blood cell, giving a total blood volume of about 5 liters. It's very important you know this. Alright, so moving on, we'll talk about electrolytes that are found in body fluid in plasma. Now, plasma contains electrolytes. We've said it, there are cations like sodium, potassium, calcium, magnesium. But the most abundant is sodium, and that's why the kidneys are constantly regulating sodium. While the most abundant anion is chloride, right? Very important, very, very important. Talk about red blood cells. The red blood cells are biconcave in shape. They are non-nucleated, and their lifespan is approximately 120 days. Now, this is important, and this because glycated hemoglobin reflects blood glucose over the lifespan of red blood cell, and that's about 3 to 4 months. So take note that lifespan of red blood cell is about 3 to 4 months. Now, red blood cell contain hemoglobin, and hemoglobin itself is made up of heme and globin. Heme contains iron and protoporphyrin. Very important. And when heme is broken down, it forms bilirubin that is used to form bile. This is very important. Take note. Now, what stimulates red blood cell production? Can you think of it? Yes, it's on the screen. That's erythropoiesis. Now, erythropoiesis is mainly produced by the kidney when oxygen level drop or anemia occurs. The liver will release more erythropoiesis, and erythropoiesis stimulates the bone marrow to produce more red blood cells. Now, all blood cells come from pluripotent stem cells inside the bone marrow, and these stem cells produce red blood cell, white blood cell, platelet. Red blood cell is also called erythrocyte, white blood cell is also called leukocyte, platelet is also called thrombocyte. Very, very important. It's also important to know that the immature red blood cell is what we call reticulocyte, while the mature one is the erythrocyte. Please take note of all these things. Now, have you heard of complete blood count or full blood count? Now, when a doctor orders for a complete blood count, they are checking for a lot of things, all the blood cells. So normally, you should know the normal ranges. For female, it's about 4 to 5 million per microliter. For males, it's about 4.5 to 6 million cells per microliter. Now, this value might change depending on your school and depending on what your professor gives you. So you work with that. Now, why is red blood cell higher in males? And it's higher because testosterone stimulates more erythropoiesis. Right? Take note. Then hemoglobin concentration for females, it's about 12 to 15 grams per deciliter. For males, about 14 to 17 grams per deciliter. And then PCV or hematocrit. This is the percentage of PCV is packed cell volume, percentage of blood volume that is occupied by red blood cells. About 45% in males and 40% in females. Keep these numbers, very important. Now, let's quickly talk about our blood cells. White blood cell, right? The major white blood cell you have are neutrophils, eosinophils, basophils, monocytes, and lymphocytes. Check out our video on white blood cell where we'll talk about it in details, right? Now, it's important you know that neutrophils, eosinophils, and basophils are called granulocytes, and that's because they contain granules. But monocytes and lymphocytes are agranulocytes. They don't have granules. Now, unlike red blood cells, white blood cells have nuclei, so they are nucleated, and their major function is defense, body defense against infection and foreign invaders. Take note. Excess white blood cell is called leukocytosis, but low white blood cell is called leukopenia. It's also important that you know that excess white blood cell can lead to leukemia. There's a pathogenesis for that, and when there's low white blood cell, patients are prone to infection. Moving on to platelets, right? Platelets also called thrombocytes. Their major function is blood clotting. Now, you should know that the normal platelet count is around 150,000 to 400,000 per microliter of cells. So, platelets are technically not true cells, they are fragments of the megakaryocytes. So, massive giant bone marrow cells break apart and release platelets into circulation. Right? High platelet count is thrombocytosis, while low platelet count is thrombocytopenia. And patients will bleed easily from thrombocytopenia, while in thrombocytosis, patients will clot more easily and it can lead to intravascular clotting. Take note. And many platelets are usually stored in the spleen. So if the spleen enlarges, like in splenomegaly, more platelet gets trapped there and to cause thrombocytopenia. This is very, very important. Alright guys, so today we have covered plasma protein, albumin, globulin. I've looked at red blood cell, white blood cell, platelets, hematocrit, hemoglobin, erythropoietin, full blood count. And trust me, if you understand these basics properly, physiology will become easy. And by the time you get to pathology and hematology, in fact, medicine overall will become easier for you. Now that's how this concept should be understood, clear, precise, and exam ready. If this helped you, go ahead, like the video, drop a comment, and tell me what topic you want next. This is Dr. ABM, where you don't just study medicine, you master it.